Hello everyone, today I'm with our patient from US, right?
Yes, USA.
And he did Ilhan method for tibia surgery and he reached 2 centimeters right now?
Yes, yesterday 2 centimeters.
Perfect. And how do you feel right now?
I feel good, staying active.
Okay, how is your pain?
Not bad, just in the nighttime, just a little discomfort, but it's nothing very severe.
It can be manageable, right?
It's manageable, yes.
Okay, perfect. And it's not your first surgery. He did before femur Precice lengthening, 8 centimeters?
Yes, I did my femur in USA and I reached 8 centimeters.
Perfect. I want to ask a question, sorry about it, but how old are you?
I'm 63 years old.
63 years old, guys, and his body condition is perfect. Your walking is also amazing, and he's doing lengthening for tibia, and this is really good. Which one is the hard, for femur or tibia?
Well, when I did the femur, I had Precice 2, so for 3 months I practically lived in a wheelchair because it was not weight bearing. So they just had us with a walker. So I did physical therapy 5 days, but it was much harder than the tibia now. I like the LON because it's weight bearing and I get to move around and I get to do more exercises.
And it's looking uncomfortable, but you say I feel good, right?
Oh yes, now I feel like it's a part of me now.
And also during lengthening, he can able to use Alter G also.
Yes, I did the Alter G for like 15 minutes, and not bad for my 3rd week here recovering.
How was your physiotherapy session?
Oh, I love it. I go to physical therapy 5 days a week. I also come to the gym like 3 to 5 times a week. Perfect. On my own because you have to do your work too. You can't just depend on the physical therapy because it's like an hour. You got to put your time in.
Of course.
And that's how you're going to get the benefit.
You can do your daily routine, right, with the fixator?
Yes, the only thing
Do you need any support?
No, the only thing I miss is a shower. So I got to, but I can do everything on my own. I shave, I do my breakfast.
He have the open wounds, he have the bandages, that's why he cannot take a shower with the fixator until removal, I can say. And after removal, when he wounds close, he can take a shower also. But right now it's hard to.
Yes. But you adapt because me being a military and being in law enforcement, so I have that discipline where you have to adapt to the situation and do what you have to do in order to finish the process. Don't fight it, and there's a process you got to follow. And if you follow, you're going to have success.
And are you happy in the center?
Oh, I love this place. I wish I came here for the first operation. It has everything here. I mean, the staff, the accommodation, the nurses, the therapists. This is a great place. I recommend this highly.
Wow, thank you so much. And I'm so happy for you. And you are doing well because you are 63.
Yes.
You are keeping lengthening. This is amazing. And patient always ask what is the average age for the limb lengthening surgery, and you're showing to us everything is possible,
Yeah, I'm proving that age is just a number because this is something I always wanted to do for me, but I have a family responsibility, so now at this time in my life, I want to do this for me, and my son said, go ahead. He encouraged me, go ahead, do it. It's your time.
This is perfect. Your family staff will be support to you. You will be more motivation. You can focus your lengthening, exercise. You will not get the stress when you turn back also. This is important.
Yes, you need a strong support system. That's why this place is so fantastic because I'm here alone, but I don't feel alone because I'm constantly getting supervised. The nurses come twice a day. I see the therapist physical 5 days a week. Any issue that comes up, they on top of any situation. So, I feel very comfortable here.
Like a family.
That's what it is, yeah.
It's perfect, guys. And it's not just surgery because surgery maybe it's 3 hours and then you will come to center. The process will start it almost 3 months. That's why the important thing is when you come to center, you will start to fight with tightness because he's doing lengthening. Muscles can get tight also. And can you compare the first lengthening process and right now tibia?
With the first process in lengthening with the femur, it was tough because you know, I had to practically live in a wheelchair because I had the Precice 2 where it was not weight bearing. So it was hard for me to do. You know, I didn't have accommodations like I do here. So you know, I would see the doctor once every 2 weeks to review my X-rays, and then go back to the hotel. And you know, I lived in a hotel for 3 months, and I had to do mostly everything on my own because I didn't have a support system in place. Where, you know, the institution where I got the first surgery, they don't supply what you need after surgery. Livelifetaller, everything is in place for you. From the minute you come here, from the minute you go to the hospital, get discharged, you have nurses here, you have physical therapy, you have a supervision at all times.
And also we are curious about your nutrition too. And I mean, Meltem.
Oh, I forgot to mention, yeah, nutrition is very important. You have a nutritionist that designs a meal plan for you. In my case, I need to build calories up. I need to eat a lot because I don't eat a lot. So she has me on a 2,500 calorie intake, 150 grams of protein. So, I mean, it's great, you know. I just miss my coffee, but after the lengthening, then I can drink my coffee.
Yeah, don't drink that right now.
She's good. She's really good. The process over there in the States was much harder. It was very hard, you know. And then once I finished reaching my goal, 8 centimeters into my femur, for the next 3 weeks, I started getting severe nerve pains in my left leg.
After stop lengthening?
After I stopped lengthening. So once I reached 8 centimeters, because that's all you can do in the States. So then I asked the doctor, you know, what can be the problem? You know, he said, well, he couldn't have an explanation. He referred me to another doctor, and they gave me 2 injections on my left tibia area to subside it. And then after that, I stood there for another month until I was able to stand on my feet again. Mm-hmm. And in 4 months, I was able to go out to the gym and start working out because, you know, I'm determined. But it was much harder, the femur, than now what I'm doing the tibia here in Livelifetaller. Over here, I have a tremendous support system. You know, I don't feel I'm alone. I mean, you know, you have everything in one place. You know, every 2 weeks you get an X-rays. Dr. Halil reviews the X-rays, and then he messages you, lets you know everything looks good, normal, no complications. He also visits you in a hospital room. I mean, a hotel room, which well, Livelifetaller, I call it a hotel, but he visits you, and I mean, that's comforting that a doctor, you know, comes in, you know, takes the time because, you know, he has a lot of operations.
It's important because, like, when you see the doctor also, if you have question, you can ask the doctor also.
Yeah, and you know, this is the human part of it, you know,
course.
Humanity.
Of course, and when you see your doctor, you will be more comfortable.
Yes.
It's important.
Yes, and you know, I feel very comfortable once I did my research here, and on Dr. Halil, you know, with his experience, I felt very comfortable traveling from the U.S. to come here. And like I said, you know, I wish I did the femur in this place.
I'm happy to see you there. Your lengthening process is going well also. You reached 2 centimeters. What's your goal?
My goal, I always set the bar high. So I'm going to shoot for 8. I'm going to work very hard, and if I, you know, for some reason I can't do it because of my body, my body will tell me, then I have to stop based on my body and recommendations from the doctor and the staff. But my goal always shoot for the top and work towards the top, determined.
And yeah, it's about your bone healing. It's about your flexibility. We always say don't focus the number and listen to your body language. Body will say, you can keep it or you can stop it, and then can make a program for the removal. But it's still too early to talk about removal, and we will work hard and we will reach your goal also.
Yes, yeah, with the help of the staff and me and my determination, you know, we'll see what happens.
Okay.
But I'm happy. For number 1 is the weight bearing that, you know, as soon as I was in the hospital, I got out of the hospital, And one of the nurses was taking care of me from Live Life, I forgot his name. He was real good, very attentive and everything. I said, I want to go to the bathroom and brush my teeth, clean up. And he said, yeah, and I was already walking. I mean, the second day, you know, I was already ready to walk. So I picked the LON because of the weight bearing. Also, it gives me a chance to reach my maximum 8 centimeters. Because my goal has always been 8 and 8, 16. But for some reason, if I can't reach it, then it is what it is. Well, everybody is an individual. Everyone has their reason why they want to do this. This was personal. You know, I always had an issue about my height. It never stopped me from doing anything in life. I was in military and law enforcement. I boxed, ran marathons. But I always had this thing. The issue was with my height. And I never had the chance to do it until later years in my life. And advise or recommend anyone that has any issue about their height or always struggles with their height to do your research, know what you're getting into. It's a big sacrifice. You have to be disciplined, and you have to do your research. Like I said before, I highly, highly recommend Livelifetaller because you have everything in one place. You don't have no worries about anything. Go for it, man. You only live once. You only live once, man. Go for it. Follow your dream. How do I motivate myself? I've always been a hard worker and disciplined, so I try to not think about the times. Every day, I just try to knock off, okay, get up in the morning. I get up at 5 in the morning, start moving, stretching, start moving around, make my breakfast, stretch around, then come to physical therapy, then, you know, watch movies, read a little, and just try to stay focused. Don't want to look at, okay, I have 2 more months to go. You know, you have to be mentally strong for this.
You should ready for the surgery because it's not just a one day. The process is almost 3 months, and you should be ready.
You have to be physically and mentally strong, because if you don't come here physically fit, then you're going to have a hard time, because if you drink or you smoke, you can't do that and expect to come here and expect miracles, because it's not going to happen.
Thank you for all aspects. Let's keep lengthening. Let's see how is your lengthening process, okay?
I appreciate it. Thank you very much.
Thank you too.
Live life taller.